Hi everybody, this is Kevin with Garrison Dental Solutions, and today we're in the studio with Dr. J.D. Corey. I wanted to ask, what is deep margin elevation and why should the average dentist care?
Deep margin elevation, I think, used to be known as cervical margin relocation, but it's basically when you have a very subgingival preparation that's approaching biologic width of the tooth. So we're talking something beneath the sulcus. The goal of this is to get that margin to a place where we can achieve predictable results with our bonding, and at the same time create a proper emergence profile that's really difficult to achieve with these subgingival restorations. And it does a great job for both direct and indirect restorations. Especially with scanning now, it's nice to have a preparation where your margin is accessible. You can keep it isolated easily during the delivery or the cementation process. The main source of failure is going to come from that deep margin. It's the bond beneath the gum tissue that's much more challenging, and so that's why we do want to take some extra steps, some extra precautions to help with that.